Thank you so much for joining us for another dispatch from the front lines. This is an ongoing series from the Congressional Progressive Caucus Center. Each week, we hear from people whose lives have been upended by this pandemic, from our movement partners and from congressional champions who are fighting for policy solutions that help our families and communities. I'm Alan Barber, the Policy Director of the Congressional Progressive Caucus Center. We're a nonprofit organization that works to inform the public about policies that promote justice, equity, and fairness. The U.S. is now at the center of the coronavirus pandemic, and the federal response thus far has not met the scale of the crisis working people and their families are facing. Nowhere is this more evident than in nursing homes, the sites of some of the earliest and worst outbreaks to date. As of late June, a shocking 43% of people who died from COVID-19 were nursing home residents or staff. Sadly, we know that this crisis of care affects both residents, their families, and the care workers who work long hours in dangerous conditions for low pay. The national survey by SEIU, the nation's largest union of nursing home workers, found that 80% of nursing home workers fear for their lives and believe that the government isn't doing enough to protect them. Frontline workers across the board report that they're exposed to COVID-19 on the job, but they lack regular testing, PPE, paid sick leave, hazard pay, and other critical protections. Rather than just creating a new crisis, the coronavirus has compounded existing ones and pushed us to new extractive extremes. Greedy for-profit corporations and private equity firms that run or own a significant stake in many nursing homes continue to try and maximize profits regardless of the human impact during the pandemic. For instance, evicting elderly residents from their homes in an attempt to make room for more profitable residents. These corporations have even lobbied for regulations that prevent any accountability for their cruel behavior in the form of corporate immunity. At the same time, the federal government has not acted to stop the spread of the disease or adequately protect nursing home residents or staff. Tonight, we're lucky to be joined by an incredible group of workers, policy analysts, and a member of Congress who have been on the front lines of care throughout this crisis, including Representative Jan Schakowsky of Illinois, Eric Carlson, the Directing Attorney of Justice and Aging, Abigail Zapote, the Executive Director at Latinos for Secure Retirement, and Mercie, Blott, a CNA working in a nursing home in Miami, Florida, and a member leader of SEIU. We'll begin this segment with a conversation with Representative Schakowsky. It's my honor to introduce our congressional guest speaker of the night, Congresswoman Schakowsky. Representative Schakowsky represents the 9th Congressional District of Illinois and focuses on healthcare and senior issues in Congress. She's the Senior Chief Deputy Whip, serves on the House Democratic Steering and Policy Committee, is the co-founder and co-chair of the House Democratic Caucus Task Force on Aging and Families, and is the vice chair of the Congressional Progressive Caucus. On May 5th, Representative Schakowsky introduced the Quality Care for Nursing Home Residents and Workers during COVID-19 Act of 2020 and secured some of the key provisions from this bill in the HEROES Act, which would guarantee better quality of care and protection for nursing home residents and care workers. Congresswoman, thank you for joining us tonight.
Thank you.
Let's talk a little bit about the nursing home crisis and how it's been exacerbated during the coronavirus pandemic. The CARES Act provided $200 million to the Centers for Medicare and Medicaid Services to help mitigate the spread of nursing homes, but the situation has only worsened since the start of the pandemic. You led a lot of the effort to include some important provisions from the legislation into the HEROES Act to address some of these issues. Can you tell us a little bit about what you helped secure in the HEROES Act and what more lawmakers can do to address this crisis?
You know, I'm really happy to do that. And you mentioned the large percentage of people who have died that are in nursing homes. My state, it's been over 50% at a time. In Minnesota, at one point, it was over 80% of the people who died were in nursing homes. And I'm very happy that I was able to get some of the provisions. I'll run through them really quickly, but I want to tell you that even these are not enough. There needs to be much more concentration on nursing homes, which were a problem even before COVID-19. But now, really, we know that over 55,000 people have died in nursing homes, workers and residents. But in that legislation, we got an appropriation for $500 million for states to establish and implement strike teams. 150 million was appropriated. It's still not enough to strike teams, to have people to come into facilities to help when there's a real problem going out there, and help with infection control, et cetera. We got a mandate for the Department of Health and Human Services to collect information. I tell you, it has been like pulling teeth to get HHS to even collect the data that we need to know what is going on in the nursing homes. We certainly are getting no real federal leadership on the issue. We have a mandate for the Trump administration to develop a specific strategy to make sure that there is testing going on. But we know the problem that we've had with testing. And at various times, the administration says they want to wash their hands of testing. And they told my governor, we're not giving you any more help. It's in the bill, though, and we can push to get it done. You know, one of the things in nursing homes is the isolation, and we got a provision that there will be televisitation in nursing homes to at least help people communicate with their loved ones and their doctors, and the creation of a COVID-19 specific long-term care facilities program to see that we can help with the kind of isolation. But again, I want to emphasize to you, this is a problem screaming for national coordination. Someone to make sure that the PPE, the protective gear that is getting to workers in nursing homes, no national help there. To have a czar overlooking issues like the testing, making sure that that is happening, and the strike teams to make sure that we're going into the hot spots. So, you know, I take pride in what we did get in, but I want you to know that we have so much more to do to protect people. And if you listen to the lieutenant governor in California, who basically said out loud that seniors are just going to have to sacrifice in order to get rid of this. We're going to have to sacrifice seniors, believe it or not. Okay, that's the answer.
Thank you for all of your efforts and leadership on this. I want to turn really quickly to the issue of corporate immunity. 70% of nursing homes are privately owned, and they've been lobbying for legal immunity from lawsuits related to the COVID-19 pandemic. What would be the consequences here with nursing homes? People running nursing homes are putting profits over patients' lives in the midst of this pandemic. Well, what does that mean for the residents?
Yes, you should know that while 70% of the nursing homes are privately owned, 85% of their money comes from the federal government. So they are making a lot of money. And we have, I'm trying to find the place in my notes where I wanted to give you some of the really good answers to these questions. Yeah, 85% Medicare, Medicaid for these. And we have seen private equity go in now and buy a lot of these nursing homes, and some of them they are taking from the not-for-profit sector, turning it into the for-profit sector, and then actually milking those nursing homes for all the money that they can get. After a buyout, these private equity managers are incentivized to quickly and dramatically increase the value of their portfolio, in this case, nursing homes, and we see the conditions deteriorate. The very idea that there should be some kind of immunity for these companies means that not one of those families that lost someone in a nursing home can find justice when there has been negligence on the part of the nursing home, when there's been mismanagement, when, you know, and we know, you even see advertised on television, people who say, did your loved one get bed sores and all these things in nursing homes? That there is the need to hold these states to go after them, but certainly not any kind of immunity blanket. This is what the this is now what Mitch McConnell is really looking for. That nothing that happens during this COVID-19 crisis, no one needs to be held accountable. It's the opposite. At this moment, when there are opportunities for a pandemic, what's the word I'm looking for, Osara? Anyway, that when we are looking at opportunities for companies to go in and make a profit on this virus, we cannot allow that. And so this is a really big deal. Excusing, it's like saying that we're going to let polluters get away with it in the environmental arena. We're going to let nursing home owners get away with it in this arena. No.
Wow, it's amazing that even though private firms control 70% of nursing homes, 85% of their money comes from the federal government. They want to claim.
And even at this time, non-compliance with federal guidelines and significant cuts in total nursing staff has happened. And we had in the state of Illinois, thank goodness, and I know you're going to hear from a worker that they actually threatened a strike in the SEIU organized nursing homes and won. And so you're going to want to hear from our nursing home worker. But even so, these are mostly women. They're mostly women of color, and what they won is some hazard pay, which is awesome. But still, the basic pay about $15 an hour. It's like, come on, essential workers deserve to get real pay for the risk that they take every morning when they go to work.
Absolutely. And thank you so much for being a champion for all those frontline workers in nursing homes in Congress. And thank you for taking the time to. Thank you for taking the time today to. I know, even though we're all working remotely, I know that you're still working. So I appreciate you taking time out of your busy schedule to join us tonight. You're more than welcome to stick around for the rest of the dispatch, but I fully understand if you have any other appointments that you have to make tonight.
Thank you. I'll stay for a little while. Go ahead.
Great, glad to have you here. Next, we're going to turn to Eric Carlson from Justice and Aging. Eric has represented long-term care consumers and their interests for 30 years. He's a directing attorney at Justice and Aging, which promotes income security and adequate health care for low-income Americans. Eric, what could the federal government do right now to better protect residents of nursing homes?
Well, thanks, Alan. A couple things. You'll see I'm going to reinforce, I think, some things that Representative Schakowsky just said. The testing and the personal protective equipment are vital. If you look at it, and I'm sure other folks will mention this as well, the folks who work in nursing facilities, for example, the virus is infiltrating nursing facilities oftentimes without people knowing of its presence, and then without staff having the resources to adequately take steps to protect themselves and the residents of the facilities. It's really just basic. It comes to the core of proper infection prevention protocols in health facilities, and that's what's needed. And as Representative Schakowsky pointed out, that to a significant extent, the federal government has said that it's not the federal. Inexplicably, I think, has said that that's not the federal government's responsibility, but it has to be. It shouldn't be in a position where states are fighting amongst themselves, and then within states, healthcare providers having to fight it out between themselves and with other people. So access to the testing, so people, the facility's going to know who's positive and who's not. And so, for example, employees who are carrying the virus, that'll be known, and those folks can step aside and allow others to work while they recover. So those two things are it's a gaping hole. It's been clearly identified, hasn't been rectified by the federal government. Additionally, there needs to be some modification of the visitation policies that currently, to a great extent, there just haven't been visitors, in-person visitors in nursing facilities since early March. We're talking about 4 months at this point. And the virus is dangerous. So is being without access to family and friends for months on end. Representative Schakowsky talked about some electronic access, which is critical. There also needs to be some more nuance in the standards. So visitation is allowed outdoors and as necessary given the residents' circumstances. And currently, as it's played out, there hasn't been enough of that. And people are dying due to isolation, due to depression, due to not having their family members assist as they did in the past. And then I'll mention two other things. One, Representative Schakowsky talked about standards for facilities that are specializing in essentially COVID positive residents. That's needed. The federal government has waived many quality of care regulations and hasn't established specific standards for those facilities and transfers to those facilities. And then finally, there have been very limited surveys, government surveys of facilities over the last 4 months, with the exception of some infection control focused. So there haven't been any ability for residents or family members to make complaints. There's been a lack of oversight, and 4 months in, that needs to change.
Thanks, Eric. You recently testified before the House Select Committee on the coronavirus about this crisis and the need for stronger oversight that you just mentioned. What else specifically do you want to see our elected officials do to protect nursing home residents and older Americans?
Here again, I think I'll reinforce, I hope, some of the things that Representative Schakowsky mentioned, that strike teams have been identified as being very effective to allow, and the strike teams within the states tend to be a group of medical professionals. Sometimes they're academic folks, sometimes they're National Guard, sometimes they're EMT, sometimes previously retired state health people or current state health people that go into nursing facilities with the task of identifying problems, providing technical assistance, and assisting to the extent necessary to get things straightened out in the facility. So a bad situation doesn't become a catastrophic situation. Support for those programs is vitally important. That's something the federal government can do.
Yeah, that sounds outstanding. I mean, not only is such a service needed right now, given the unemployment rates that we're seeing right now, that's another source of jobs that is much needed in many communities and states around the country.
It's work that just it needs to be done. And as Representative Schakowsky mentioned, that's a provision within some pending legislation. Also, the standards for infection prevention could and should be improved. The current federal regulations talk about an infection preventionist, but mention that person as a part-time person within a nursing facility. As a practical matter, this is usually just a nurse in a nursing facility that also has a designation as infection preventionist. and may spend relative up to this point, maybe has spent very little of his or her time focusing on that. Given this situation and the likelihood that it may be with us for some months or years, that position has to be elevated as well to recognize the crucial nature of identifying, preventing, and controlling infections within nursing facilities.
Excellent, excellent. With that, we're next going to turn to, unless Eric, do you have anything else you'd like to add about steps that the federal government can take right now?
No, I'll wait, and if there's some questions later, I'd be happy to address them. Thank you.
Great, and we will have one or two questions later this evening from some folks who have weighed in, who are watching this segment. So we'd be happy to hear from you then. Next, we're going to turn to Abigail Zapote. She's from Latinos for a Secure Retirement. Abigail is the executive director of Latinos for Secure Retirement, and she leads a coalition there of national Latino organizations to advocate for Social Security, Medicare, increased pension access, and greater financial literacy for Latinos of all ages. This summer, Latinos for Secure Retirement is focused on bringing culturally relevant and timely programming to ensure that our communities have access to safety net programs. They are also bringing experts to guide conversations around what it means to properly secure one's finances into their golden years, with a sober and respectful look at how Latino families can best prepare for the passing of loved ones amidst the COVID-19 health crisis. Abigail, thank you so much for joining us this evening. How can you tell us a little bit about how the coronavirus has affected your work and your base?
Yeah, thank you, Alan, so much for that introduction and for having me today. For our community, like many communities across the country, the conversations around the kitchen table have changed in a matter of days. Folks are confused, uncertain, worried, and our primary discussions as an organization of benefit access turned into a discussion of immediate health risks, financial risks, and deciphering the differences between social distancing, quarantine, or isolation, especially as Latino families live in multi-generational or multi-familial homes. It's been our mission from our onset to ensure that Latino elders have equitable access to benefits stemming from the Older Americans Act, but this in itself is a challenge due to the lack of trust in institutions and cultural inequities to access beyond just language barriers. And nonetheless, these resources are just absolutely necessary, which is why we're ensuring that we're driving these resources to our communities. Unfortunately, because of the rhetoric coming directly from the White House, it's really difficult for our communities to really see these safety net programs as something that they should be accessing. They think that that it's a government handout, when in reality, these are benefits that they are entitled to because of the taxes that they continue to pay. And I think additionally, we need to also be thinking about, or our organization continues to think about, older undocumented immigrants who continue to work to make their living after retirement age because they cannot have access to the social security benefits. Unfortunately, there is still a lack of information on COVID-19 in our communities, as most updates are shared digitally and in English. In our community, unfortunately, there is still a huge digital divide, and even some of the translations that we get are not as current as we would like them to be. And so we would love for folks that are tuning in to be able to join us in some of these conversations. They can register via bit.ly at /LSR events in all caps. We definitely want to make sure that our informational programming really reaches those folks who may not have other access to information. And so we really hope that folks can be able to join us within the programming that we're hosting.
And for the folks who are tuning in, that link will be dropped in the chat and will be available in the video that is posted on Facebook as well. Please be sure to look into that and look for ways that you can help. I want to ask you a little bit about the racial divide we're seeing with COVID-19 cases and deaths in nursing homes. Overall, we know that Black and Brown communities are more susceptible to COVID-19 and are seeing higher infection rates and higher death rates. This definitely transfers over to nursing homes. Data seems to indicate that nursing homes with predominantly Black and Latinx residents are twice as likely to have suffered a COVID-19 outbreak compared to nursing homes with white populations. Can you talk a little bit about that? And I know Representative Schakowsky and Eric got into a little bit of the issue of documenting the different groups that are impacted, but can you tell us a little more about that and what's happening, what you're seeing?
Yeah, I think in general, much more attention needs to be paid to the risk of COVID infection in nursing homes, but especially the nursing home staff who work at multiple facilities. As you mentioned, Latino and Black Americans are 3 times as likely to be infected with COVID-19. And these disparities are driven through inequality rooted in systemic racism that that is severely impacted due to the lack of budgeting that goes to some of these facilities. These disparities in healthcare access and economic issues add to the staff in nursing homes getting sick. And not only that, but it also creates a cycle of infection as the virus is then taken home or to other nursing homes as folks aren't earning a living wage in one location. And especially as I mentioned before, these folks are also living in multi-generational or multi-familial homes where they can't socially distance from their own family members. And just recently, the CDC reported that Hispanics are 4 times more likely to be hospitalized from COVID-19. And this has a lot to do with the fact that our communities, Black and Brown communities, are overrepresented in these blue collar jobs. And also part of the reason why there's been an increase in infection is due to the deregulation of nursing homes by this administration. And 2 things are happening. Residents are being infected in such facilities and account for 45% of deaths of COVID-19. So that in general should be raising a red flag to all of our legislators and folks in general to know that there should be best practices created for these nursing home facilities, especially because history is repeating itself. And I mean history that just happened in March, where we saw how these nursing homes were being ravaged by COVID-19. And now we're seeing the same thing happen in Florida and Georgia and Texas, and basically just amongst the southern states. And so there are few places that represent the awful consequences of this neglect more than nursing homes. And as you know, I reiterate this because of the nearly 130,000 coronavirus deaths, more than 40% are coming directly from nursing homes within their residents and within their employees. And so we need to make sure that not only are we ensuring that PPE is being equally distributed within these nursing home facilities, but that money from the last CARES Act bill is actually distributed to these places, because just like hospitals, these are the places where folks are being taken care of, but unfortunately they are continuing to be neglected. And for the folks, again, that are listening, we definitely want to encourage them to act now. Our organization, along with Social Security Works, has started a joint bipartisan campaign called Nursing Home Crisis. We'll also send the link in the chat box and in the messenger feed as well, because we definitely want to make sure that as many folks that are outraged by what's happening, that they also take those tools and act to make sure that our members of Congress are listening to us. But at the end of the day, that we also come to a clear solution to make sure that these folks in these nursing homes, whether they're residents or whether they work there, are also protected.
Thank you for that, Abigail. Quick question. I was wondering if you talked a little bit about the deregulation that we're seeing in nursing homes, especially under this administration. Can you just dig in just a little more on what that deregulation looks like compared to, say, the Obama administration or previous administrations, and a few more details of how that's playing out specifically?
Yeah, I think, most importantly, I think you mentioned it earlier in your remarks, that folks that don't necessarily have wealth behind them or don't have insurance policies that are really taking a lot of these costs. They are basically being kicked out of these facilities to make room for folks that actually do have wealth behind them, that actually do have more resources behind them. And that completely goes against the reason why, one, Social Security was created back in the 1930s, because that's exactly what was happening during the last pandemic, where folks were literally put into poorhouses and left to die. That's literally what's happening right now, and this current administration is allowing to do that. And so there's definitely more in depth that we would love to chat about. If folks can join us on that nursing home crisis website, we definitely would love to be able to give out more calls to actions to those folks. Because again, like I mentioned, we just need to make sure that we're staying on top of this, because our elders, our viejitos, are being completely decimated by this disease.
I want to say thank you, but that's a really grim picture that you've painted. I really do hope that I'm given some hope by the work that your organization, by Social Security Works, and by so many other champions of our elders and nursing home patients in general, the work that they're doing to change that now. I hope that we can really, really make some strides in the right direction and make sure that our elders get the care that they deserve. With that, I'm going to turn to a worker who actually is at a nursing home, who spends time on the front lines day in and day out. And Mercie Blott is a certified nursing assistant at a facility in Miami, Florida, and she's a member/leader of the Service Employees International Union, also known as SEIU, and is a Haitian immigrant and has been in the country for over 18 years. She has been working in the nursing home facility for 16 of those 18 years. And we're so excited to have you join us tonight. The crisis in our nursing homes isn't just affecting the residents. It's also affecting workers like you, who are risking their lives and their families to serve residents. First off, Anne, how are you doing during this pandemic? We know your job isn't always easy, but we'd imagine that it's even more challenging right now. Can you tell us about how things have changed for you since COVID-19 hit?
Thank you for having me. It has been changing my life, my personal life, and also my work life. It has made my work life, very frustrating. I've been working Hampton Court Nursing Home and Rehab for 16 years now. Before COVID-19, every morning when you woke up to go to work, you look forward to seeing your residents. But now with COVID-19, it's like, oh my God, protect us. Our residents are like our family, our second family. And this is what we are for them, their family. In the morning when you go, you find them, it is a pleasure. You feel happy to see them, to hold their hand, even to give them a hug. When you give them, they feel like they're being loved. So, but unfortunately with COVID-19, we can't do that anymore. So it's like, very frustrating. It is hard.
Well, I could imagine. I can't imagine how hard it is. It must be incredibly difficult work. So I do want to thank you so much for everything that you do to care for our loved ones and keep them safe. You're a member of SEIU Florida, You and your coworkers are fighting for nursing homes that are safe, just, and equitable for staff and for residents. Can you tell us a bit more about what changes you'd like to see in nursing homes?
Right now, the world is unfriendly. You can no more socialize. And our nursing home, when we go to work, like I said earlier, we are family. We take our coffee together with our elders, with our residents, close. At home, I mean, your kids can no longer play with their neighbors. They can't play with their family because everybody's afraid if you have or not the virus. I'm afraid of after work to bring the virus home to my kids or my husband or even friend. At work now, it is very it is very hard. We can go into, like, when you go to work, you see your patient, and now you like, am I gonna give them? Do I have the disease? Can I transmit it to them, or can they transmit it to us? For that reason, we work with fear. We also don't have enough adequate PPE to work. So I would like to see, when you go to work, you have enough and adequate PPE to work to protect your residents, to protect yourself and your family. We also don't have, I mean, you go to work, they give you a KN95 to work with a resident who has COVID-19. Once they're supposed to give you N95. The KN95 did not protect you as the N95 does. They will give you a single gown for the entire shift. When those, they are single use. So after using one for a patient, you should have throw them, but you will use it for the whole shift. I'm talking about 8-hour shift or 12-hour shift, sometimes 16-hour shift.
And what does management say when you mention, when you point out that you're using old equipment or inadequate equipment?
I mean, even they give it, before they give it to you, they tell you that that's what you're gonna use for the entire shift. They tell you right in your face. I mean, it's not something they try to hide, because they will tell you because they don't have enough. I mean, if they give you, let's say for 8-hour shift, they will give you, and you have 8, 9, sometimes 10 patients. So imagine if you go to one of the patients 3-4 times in your shift. So they will have to you will have to change this gown 3-4 times for that same patient. You imagine. So they're not prepared for that, and they will not do that. You don't get hazard pay. You don't, beside of your PTO that you earn, if you go out sick for a month, you don't have pay. You don't get paid. You don't get paid. They don't get to hazard pay. They don't get to sick time pay. So it is, and that means, I mean, if you out for more than a month, you're out of pay, and your family is depend. As a matter of fact, my family depend on my paycheck. So it is. I would like to see. Change stuff like that changing. We get paid. We don't have to. I mean, decide if we have to pay our rent or get health care. So
right.
It is.
Nobody should have to make that decision. You're right.
Thank you. So I would like to see all these kind of thing changes. And also it is now time for our official elected to take responsibility. I mean, we keep asking, but we don't see anything change yet. So we need to see those changes. We need to see more testing, not less testing. We need to get hazard pay. We need those things because we depend on our health to care for our nation's elderly residents. So it was a pleasure for me to be here.
So I really do appreciate you being here tonight, because a lot of us think about our elders in nursing homes. We often think about it kind of abstract. We don't deal with it firsthand. So for a lot of people, this may be a first. You may be giving people a window into what's happening right now. The crisis is happening on the ground. So I don't want to give you too many surprises, but I just want to ask a few more questions about what you're seeing, so that people can realize the impact, the toll that this pandemic is having on the people who are caring for our elders and our loved ones. Could you maybe speak to how things have changed in terms of family members coming to visit your residents in the nursing homes?
The family can't come into the nursing home right now. So the only family they have, it's us. Mm-hmm. So, because of the pandemic, everybody, family members, doctors, everybody are quarantined. So we are their only family. And that's why they depend on us and we depend on them. I mean, we depend on the job. So our residents depend on us. So if we get sick, they are alone, they're by themselves. But also the companies they need to help us, get us protected, so we can be safe, for us to care for them and keep them safe.
On that, thank you for that. And on that note, I want to relate some of what you just mentioned. I want to ask Eric and Abigail for some input from them on this. Eric or Abigail, I know you've touched on some of the legislative changes that could be made in nursing homes now. Could you talk a little bit about a little more about how these changes might directly impact staffing issues like the ones that Mercie just told us about?
Yeah. I'd say one issue would be accountability. It's mentioned earlier of the many millions of dollars, hundreds of millions that have gone to healthcare providers. But the question is, how's that money being spent? And it should go to certified nurse aides and other people like Ann who are doing that work. So there needs to be accountability in how that money is spent, in some sort of focusing to make sure that nurse aides and others have adequate sick pay and are properly compensated for the hazardous conditions that they're encountering. It's vital. And Representative Schakowsky mentioned this, that some of the entities that operate nursing facilities don't have the best track record for putting their money in the right place. And as she also mentioned, that Medicare and Medicaid constitute by far the bulk of the revenue of nursing facilities, that as taxpayers and as people concerned with healthcare in this country, I think we have the right to demand greater accountability so that the money goes to care providers and to care.
And I would like to add on that, as we're talking about accountability, The accountability should also go to the federal agencies who are also distributing this PPE. This is not FEMA's first rodeo in taking care of nursing homes during a crisis, right? During hurricane season, during earthquakes, etc. Those are the first places that FEMA and others should be looking into to make sure that they have a strategic plan. I think secondly, just as we're really seeing how these communities are being impacted, or these nursing facilities are being impacted, it's just some common sense stuff like cohorting the different residents who are infected and separating them from those that are not. Not only would that bring a sense of relief to the workers that are tending to these residents, but also to the families at home who are also, aren't being kept abreast of what's actually happening within those nursing homes in general. And I think, lastly, and I think more importantly, is continuing to elevate the fact that we need to give premium pay to these workers like Anne Mercie, who's literally putting her life at risk every single day by going to work. If there's any time that we can think about how not having access to healthcare affects people, not having access to adequate pay is affecting people, it's literally right now. We need to make sure that accountability also improves these mitigation efforts. As I mentioned, there has been plenty of time to learn from what happened in the East Coast and the Northwest Pacific, that we could really be looking at all the different places in the Midwest that have not been impacted directly or in as big capacity as it has in the Southwest or in the East Coast. There is still time, and we just need to make sure that there is a clear directive that's coming in from our elected officials to make sure that folks are making it a priority to wear masks, making it a priority to advocate for folks like Anne Mercie, and just in general, at the end of the day, also knowing and understanding that a lot of these folks that are home healthcare workers or healthcare workers in general are also immigrants. And these are folks that are in continued fear of not knowing what tomorrow will bring because of the attacks from this administration. So obviously there's still so much more to delve into, but again, it all really is meeting at a nexus within this crisis today.
Thanks. Next, what we're going to do is turn to a few questions from our live stream. We've had a few people write in with some questions, some based on personal experience and some in general. The first couple of questions tend more towards the personal, and I'll pose it to all of the panelists here. This is from Sally. Sally writes, "My mom is in a nursing home after a stroke and doesn't communicate well. We've been quarantined, and I'm terrified that she'll get sick or mistreated, and we won't find out until it's too late. What can families do to advocate for our loved ones in nursing homes?"
It's a common and really good question. The advice is that it's the same advice that I always give, although the options are more limited in these days. You have to work hard. You have to make phone calls, and push with the facility and ask questions and thank people for good things and push them when things aren't going well, to establish the phone communication or video conference communication as best you can, or conversations through windows. It would be helpful also to get the input of the local ombudsman program as much as possible. The program may also be limited in their ability to physically access the facility, although that may vary at this point, but they're a good resource. And
Eric, how would you reach out to the local ombudsman?
It's the telephone call. If you go to Ombudsman Resource Center, you can get the contact number for that state and then go for there. But really, I think the easiest thing, that internet access, type long-term care ombudsman in whatever state you're in, and the number's going to come up, and then follow the trail from there.
Excellent. Abby, would you like to weigh in on this question? Abigail, I'm sorry. I apologize.
No worries. I go by Abby, so it's all good.
Okay.
So I would say that, you know, first and foremost, this is your family. These are the folks that you should be advocating the most for. What we've seen folks do that can be a little tedious, that can be, you know, time consuming, but is actually going to the facilities in general and making sure that they can actually see their resident, maybe not in close physical contact, but as long as they see their window, as long as they can see a hand, as long as they can see that their loved one is still alive. And that's also part of just really being that person, being that advocate. Again, this is literally a life and death situation. And so, yes, going through the channels of going through the ombudsman, but at the end of the day, sometimes those lines can be clogged up. And at the end of the day, if that family member can go directly to that facility and say, hey, I'm here, I need to know what's going on with my family member, sometimes that actually works a little bit better than having to wait. And I'm sure that Mercie has her own opinions about that, but you know, at the end of the day, like I said, these are our family members that we need to make sure are taken care of.
Yeah, we absolutely do need to make sure that these family members are taken care of. In a recent report from my colleague Hiba Kassem, she noted the story of a man by the name of Mr. Kendrick in LA, who was in pretty bad shape and pushed out of his nursing home in LA. And his nephew received a call a couple of days later saying that he was found wandering the streets. We can't afford to let that happen to our elders and to our loved ones in nursing homes. Next, I want to turn to a question from Sam in the live stream. Sam writes in to say that my dad is in a nursing home, and for a while now, we've noticed that there's a high turnover rate in staff. It seems like they have new workers every few weeks, and it has an effect on my dad and the other residents. We're not exactly sure what is going on, but Representative Schakowsky mentioned a union win in Illinois. What can we do to support the staff or make changes? Before I turn to Eric or Abigail, I was just wondering, Anne-Marie, have you seen any staff changeover at your workplace, or has it been pretty stable?
Right now, we don't have new faces. Not just because of the COVID, but it's happening before the COVID. We had a short staffing. So with the COVID, it's been worse. So now, for a year or so, it's like the same faces, and it's like the face you see, the shift from morning, it's the same shift, the same face you're gonna see from the second shift, which is 3 to 11. So and like the family member said, it is always good when your patient, your resident, see faces that they know, because they used to. It make them feel like they're secure. It make them feel like they're under family environment. But on my facility, it's been a while we don't have new faces, because first of all, they don't even want to pay. I mean, the one who were here, they are trying to find something else out of the nursing home facility to work on, so they can get paid better than what they receive, instead of doing 2-3 jobs. So that's why not even people who is not in the facility, they're not coming in the facility right now. So that's the reason why in my facility, it's been a while, you don't see new faces.
Great, thanks for sharing that. Abigail or Eric, in those facilities where they do see turnover, because In some cases, there is some churn. Luckily, there isn't for the residents in Mercie's facility, but where you do unfortunately see this, how would you address Sam's question about what we can do to support staff and make changes?
Well, there's obviously on an individual level, it's just personally talking with folks and just supporting them emotionally as best you can. Although I recognize if you're not in the facility right now, that's harder than it usually is. Taking up their case with management, just having the best possible relationship with staff. But on the legislative or on the administrative side, I think we've talked about some of these things. There should be adequate personal protective equipment, for example. Staff pay should be better, so there would be less turnover. So it'd be a more solid job for folks, and the hazard pay and the health care and the career ladders and the support for unions in this area. All those things make it a better position and make it more likely that people are able to stick with it for the long term as a terrific career and a fulfilling one.
I think on my end, on the individual level, I think part of one in selecting like which nursing home facility you want to send your loved ones to is ensuring that the folks that are being hired are actual employees as opposed to consultants. What we're seeing, especially right now, as monies are being dispersed through the CARES Act legislation, and more staffing agencies, have discretionary funding to be able to hire more folks. They're not hiring folks and giving them adequate pay or healthcare benefits. They're hiring these folks as consultants. Therefore, they're not contributing to Social Security. They're not contributing to Medicare. They're basically ensuring that these folks don't have access to those safety nets, and that those consultants are basically taking on those taxes at the end of the year when they do their tax return. And so I think one is on that individual level is ensuring that these folks are employed year round, that they do have benefits. But then two, like Eric mentioned, is making sure that we're doing that advocacy at the top tier as well, and ensuring that if money is going to get dispersed to different places, that it's appropriately dispersed, and that folks that are being hired also have these healthcare specifically, because if you're asking folks to go in and take care of folks that are at risk, we need to make sure that those folks also have access to paid leave if they personally get sick, and then healthcare to ensure that they're protecting not only themselves, but their families back at home as well.
And I was just informed that I was muted. So whoever had host muted on their bingo card just won for the night. I was just saying that it looks like we're reaching our time for the night. It's just about 8 o'clock. I want to once again thank our guests, Representative Jen Schakowsky, Eric Carlson, Directing Attorney of Justice and Aging, Abby Zapote, Executive Director of Latinos for Secure Retirement, and Mercie Blott, a nursing home worker and member leader with SEIU. And I'd also like to thank my fantastic colleagues who help put this show together each week: Parker Breza, Laura Collins, Heba Kassim, and Jessica Scruggs. I'd also like to thank the incredible folks at WEAC TV. We're entering a new partnership with them this week. This is our first joint broadcast. Thank you so much for, especially with me, I was muted a few minutes ago. And finally, I want to thank each of you out there watching this. At the end of the day, policy alone doesn't make the change. It's the people who have the power to make the change. And all of these discussions would be pointless without your support, your passion, and your fire. Thank you and good night.